Are you worried you have to go home the same day that you have your knee replacement?
We're going to do a little video about what to expect on the day that you go home from your knee replacement, which is likely the same day as your operation.
Most likely. More often than not now, you go home the same day.
Welcome to Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzak.
Okay, so shift change in the last kind of 5 to 10 years.
Yeah. If you look at our old videos, we're like, hey, look at us, you stay in the hospital for 3 or 4 days, enjoy it. That's not the case anymore, right?
And then the pandemic happened and it pushed us to do this.
Boom.
It's already kind of happening,
It
but
was
it
kinda
was a nice
happening
little
before.
push though.
Yeah.
There's something positive that came out of it.
Yeah. And I mean, the fact that you get to go home, which is a
Right.
good thing. Now, the one thing that'll make you feel better is before you go home, you have to pass certain tests, right? With the physical therapist and the nurses. They have to make sure you can do certain things. They're the same kind of things that you had to do before, years ago when you were admitted to the
On day
hospital
5.
before you can go home.
Right.
But now they're just giving you that test earlier, okay? So you're still meeting the same criteria is what I'm trying to say.
And those are usually walking as well as going up a few stairs. We have a little simulated staircase in our day surgery recovery room area. So you'll do some stairs. You have to be able to walk. You have to be able to stand up and not feel dizzy and fall down.
You have to be able to go to the washroom.
Yep.
You have to be able to go pee, and you have to be able to keep food down. And I mean, that's all you need. What else do you
And
need?
I guess your pain has to be controlled.
You need it. That's all you need in life.
That's it. The other thing that I'd say that's neat about day surgery at our hospital is that we have something called meds to beds, which is a clever name, where the prescription that you get from us, which is a combination of pain medication and usually an anticoagulant of some sort, as well as maybe a stool softener. People are always like, well, I don't have to stop on the way home, and then that your loved one goes into the pharmacy and you're sitting in the passenger seat wondering why it's taking so long. Instead, our pharmacy brings it right to your bed, brings the meds to the bed.
That's why I love it when I have a patient named Ted. It's my favorite thing.
Come on.
Come on, you got meds to beds, Ted.
You need better favorite things.
So what do you do? What do you expect when you get home? Okay, what can you expect?
So I'm going to expect, what's your number one?
Pain, baby.
Yeah.
I'll tell you why. Because when you're in the hospital, you get a bunch of painkillers from the anesthetist. Thank you very much. You get a spinal anesthetic. You might get some nerve blocks and things, and all.
You might even have a catheter and a little bottle of anesthetic strapped to you.
Yeah, like a lot of stuff to control the pain. Then we get you home and all that stuff starts to wear off, and then all you have are your pills.
And it's varying time, so it might be later that day, might be at night, might be the next morning, depending on the catheter and whatnot.
Everybody's
but
different.
Pain's going to come, so I'd say definitely expect pain and take your pills. Please take your pills.
Yeah, take the pain pills. If you can get there before the pain comes, it'll help keep the pain at bay.
The second
and if you think you have a high pain tolerance, you don't.
Yeah, don't say that. People that say they have a high pain tolerance usually don't. People that have a high pain tolerance don't talk about their pain
and don't
tolerance.
say they have a high pain tolerance.
That's right.
Because they don't even know it. Like, I didn't feel any pain.
I didn't feel pain.
How do I know high pain tolerance? I didn't feel pain.
Like I'm tolerant.
I'm feeling a lot of pain. I must have a high pain tolerance. No.
It's part of the video. It's painful for me.
Yeah.
Number 2 for me is you're going to be slow. You're going to have some difficulty with mobility. So people are like, well, can I go up and down the stairs? Yes. You're going to do it slowly. If your bedroom is upstairs, you're likely going to come down in the morning and go back up at night for the first little while. But you're able to do stairs. You're walking, usually with almost universally with a walker for my patients. And you just have to do it slow and steady. If you drop something, let it drop. You just don't want to fall. So you're going to be slow, but you can definitely walk. So expect to be able to walk.
Yeah, you might have to let that one go to voicemail. Just can't get to the phone.
Go to voicemail.
Number 3 for me would be you're tired. You're going to feel tired. That's because you've been given a lot of medications by the anesthetist, and some of the side effects are somnolence, just things that make you feel tired, especially the pain pills. They can also make you feel tired and drowsy. So you're going to be tired when you get home.
For me, the next one is you're going to have a wound and a swollen leg. So for the wound part, there'll be specific dressing instructions that are going to come from your hospital. You may or may not have to change it. It may or may not be leaking slightly, a little bit of blood or whatever. And your leg is going to be swollen, so expect swelling. And in order to address that, elevate it, wrap it potentially with a tensor bandage, and definitely consider some type of ice strategy, whether it's ice packs or a cooling unit that has compression. Consider something like this to reduce the swelling because it's coming. Almost
something cold.
Yeah.
And for me, the last one I think is your knee is going to feel stiff. That's the biggest problem too, because your knee feels stiff and you don't bend it, and that's the problem. Just because it feels stiff, you still have to bend it. You want to keep bending it, otherwise it's going to get more stiff. And become incurably stiff.
Yes, we don't want that. I'm going to give one honorable mention. Expect that you're going to have difficulty sleeping. We have a video about sleeping after total joint replacement. Usually the first 6 to 8 weeks have been shown in research to be quite difficult. Often you're on your back. There are specific instructions in those books about how to sleep. For me, I care
Whatever
less about
works.
whether you're on your back, your
Yeah,
side, your
side,
stomach.
your
I mean,
head.
obviously you don't want to line a sore wound, but
Yeah.
that matters less to me. But you're gonna have trouble sleeping for a long list of reasons. So don't panic. This is all part of the process. Unfortunately, you just gotta kind of wait it out.
That's why we made these videos.
Yeah.
Help you sleep.
Watch some of these.
Just watch Talking with Docs. That will put you to sleep about 4 minutes, 23 seconds.
If you like this video, please like it. Subscribe to our channel. A lot of you are not subscribed, and share it with someone that you know that's getting a knee replacement, because chances are you're going to bump into someone today that is getting a knee replacement soon.
And you can check out our older videos if you're wondering, what did it used to be like back in the day? Well,
Yeah.
we made videos back in the day that told you what it used to be like. You can see how it's evolved. Thanks so much for subscribing, like Dr. Weening said, because we're trying to get to 2 million now.
Trying to get to 2 million.
Right? Because we passed 1 million.
Yeah.
And we appreciate you guys watching us. We appreciate all your comments, and we appreciate the community that you've made in the comment section. Thank you very much. We do appreciate it. And you are in charge of your own health.
We'll see you next time.